as we meet today, or that's where I'm presenting from. I pay my respects to any Aboriginal people joining us today, and I pay my respects to the other nations you are coming from. I acknowledge Aboriginal people as the custodians of the land, and I acknowledge their social, agricultural, and philosophic achievements. I acknowledge we must acknowledge the effects of colonisation to take steps towards healing. I recognise the importance of self-determination and that we must stand beside Aboriginal people to restore pride in the past and present to inform the future. So thank you for joining us today. Today's webinar is hosted by a collaborative group. This collaboration has been happening, I think, now for around 6 years, and we've accumulated around 50 different webinars to have a look at, all to do with cardiac rehab and secondary prevention. The partnership we have is between the Australian Cardiovascular Health and Rehabilitation Association, ACRA, Heart Support Australia, the WA Rheumatic Heart Disease Register, and Rural Health West. So welcome today. Usually it's my job to host the webinars, but today I'm going to present, so I'll have to, you bear with me for a minute while I introduce myself. I'm a registered nurse, registered midwife with lots of experience in cardiovascular health. Some of you in the room will know me. Together with colleagues, I've set up cardiac rehab programs, heart failure programs, Aboriginal programs, phone coaching programs, and community programs in WA Health. I have clinical expertise in hospital-based cardiac rehab programs, community programs, telephone programs, telehealth programs, and digital cardiac rehab via an app. My current position is as the National Programme Coordinator for Heart Support Australia. But today I am speaking to you around the cardiac rehab secondary prevention pathway, and I am currently supporting the work of the clinical evidence team at Department of Health WA to update the pathway. So thank you for joining us. We have people today from all parts of WA, from the Kimberley, the Pilbara, the Midwest, the Southwest, the Goldfields, the Wheatbelt, and the Great Southern, and Perth metro area. So if you could, it'd be really nice if you could pop in the chat just to tell us where you're from and anything else you might like to say in the chat. A little bit of housekeeping. The webinar will be recorded, and please put your questions and any comments in the chat along the way. Tom from Rural Health West is in the background. He's put your microphones on mute at the moment, and he'll take your microphones off mute when the presentation's finished, or if you want to throughout the presentation to ask questions or make comments. Really important at the end of the session, there will be a survey. It's 5 simple questions, and you can win a $100 voucher for completing this. So I think definitely worth the effort. So today's session is around updating the cardiac rehab secondary prevention pathway. And this is with the help of Health Network's Clinical Excellence Division at the Department of Health. So I thought I'd start the presentation referring to a very recent article which came out in MJA on the 16th of February. This is by Julie Redfern, Robin Gallagher, Tom Briffa, and Dion Chalandra. And there we're talking about how we have to reimagine cardiac rehabilitation to future-proof heart care in Australia. Their reference to the stats from the Australian Bureau of Statistics, around 500,000 Australians are admitted to hospital with a heart condition each year. More than 4 million Australians are affected by cardiovascular disease. It causes 1 in 4 deaths. But the impact on people's lives is completely immeasurable. In cardiac rehab and secondary prevention, we can't leave the cost of prevention off the agenda. Survivors of a heart event are 10 times higher risk to have a future heart attack. Within 3 years, 40% of those will be readmitted, and 20% of people will die from their second heart attack. The financial cost exceeds 14 billion each year and continues to grow. But it's the physical and especially the emotional effects of living with cardiovascular disease that are broad challenges, and these affect us as healthcare workers and people with lived experience. Thank you for putting, for anyone that's a bit later, if you could pop a bit about yourself in the chat, that would be really appreciated. So it's time, these experts say, to think about cardiovascular health. So they believe the terminology itself is a challenge because it focuses on cardiac diagnosis as opposed to broader cardiovascular conditions. They also believe rehabilitation to be for a finite period of recovery rather than promotion of lifelong cardiovascular health and lowering the risk of new events. And I always say to my heart support staff, the volunteers who all have lived experience, that recovery is a journey and there's many bumps in the road, and everyone's journey is unique and there's not an end destination. It's that destination to healing takes a different time for each person. So the other part of cardiac rehab and secondary prevention is that inequities still exist. And we have in the room today, you have come from all different areas of WA Health. There are also rural, regional and remote populations are affected by inequities. Aboriginal and Torres Strait Islander people are culturally and linguistic diverse populations, and Indian people have an especially high level of cardiovascular disease. LGBTI people may not attend mainstream cardiac rehab. People with mental illness, people of low socioeconomic status, and people with disabilities are all disadvantaged. Oh, maybe I moved my slides. So in the local context, I wonder if you could give me a little thumbs up if you recognize this pathway that was developed in 2014. Or raise your hand, has anyone used this pathway? No. So this pathway, as I said, was developed in 2014, and this part of it was the quick reference guide, but as you can see, it was exceptionally wordy. So why would we update the cardiac rehab secondary prevention pathway? Well, it's 11 years old. There's contemporary new ways to deliver cardiac rehab. There's new guidelines. Many of the links no longer work. It was exceptionally wordy. It's not person-centered and not useful to those with lived experience. It was used by those in cardiac rehab programs in the metro area, mostly hospital teams. But once patients leave hospital, primary care is in a perfect position to guide people towards cardiac rehab secondary prevention services. I think we miss out on people being referred when we don't make this easy for those in primary care. Barriers continue. Missed medications or appointments are often not about a lack of caring on behalf of the person with cardiovascular disease, but they're rather about cost, transportation, taking time off work, or having to care for others in the household or community. And trust breaks down when patients feel judged for circumstances beyond their control. So this one-sized approach no longer fits. Cardiac rehab was historically a 6 to 8 week program in a hospital. But we now have to look to new ways to deliver this. And in January of this year, CSANS and ACRA put out a position statement on the quality use of telehealth in cardiovascular care. And I think I saw Nicole Skavic in the room, and Nicole has a great reach through telehealth for patients who are unable to attend cardiac rehab. The other way that we can change cardiac rehab to allow people to live their best lives is through those who have lived experience. Researchers and policymakers must listen to those with lived experience. Peer support leaders provide a connection that has no judgment. There's no hierarchy. They can truly say to that person, I've been through what you're going through. So peer support from the get-go offers mutual respect and a sense of belonging. It's not time-bound. So currently, you're discharged from hospital, before long, off to cardiac rehab. And often it's not till 6 months down the track, a year down the track, that it hits you that this was a huge life-changing event. One of those branching moments in your life where your life changed completely. And we see this all the time in our peer support groups. We see people come because of their emotional well-being much more than they may be looking after the risk factors, but their emotional well-being is still impacted. So I'm not sure if anybody's watched a video which Solve CHD produced with the BBC earlier last year. And it's called Beats of Change. And one of our peer support leaders from Heart Support, Ross, who runs the Gold Coast group, has a video there. And his comments are, the most important thing a person recovering from heart disease needs is to be talking to people that understand and encourage you to keep moving forward. So in 2021, there was a review of the use of the cardiac rehab secondary prevention pathway. And the key messages from this were that it needed to raise awareness that the pathway existed. There needed to be more education around the pathway. There needed to be enhanced communication and collaboration with stakeholders everywhere. We needed to engage all those who care for those with cardiovascular disease, not just those who work in cardiac rehab services. And a big take home was a more simplified flowchart would engage GPs, practice nurses, and practitioners in rural and remote areas. One person said, engage me as a GP nurse to see the patient benefit, and being time poor would lend itself to the idea of an infographic, essentially that quick reference guide that I showed you earlier, updated. So this is what this project is about. So the aim is to have a standardized, high quality, person-centered care pathway for all those with cardiovascular conditions. We would hope the outcome to be, if we make it clearly easy to use by everyone who cares for people with cardiovascular disease, that cardiac rehab and secondary prevention would be part of usual care. The pathway, the lived experience, and the patient voice is incorporated in the new draft. And updating this cardiac rehab secondary prevention flowchart provides a mechanism, especially for GPs and GP nurses, where patients who initially decline, and we did look at the reasons for declining, would be offered re-entry. The benefits are to enhance efficiency in referral numbers, and that will result in less admissions and improved quality of life for those living with cardiovascular disease. By providing a genuine connection and dialogue with all health professionals involved in care will ensure that the pathway is user-friendly. So it's great to see a broad representation in the room today. The pathway will promote better care integration and transition between tertiary and primary care services and increase referrals. So to do this, we have to set some goals to updating the pathway. So the first thing is to work with the team in the Clinical Excellence Division to see to all those processes, like make sure the project sponsor is clear on what she would like. That's the Director General. There's a clear project plan. There's an action plan, engagement plan, communication plan, risk register, and consultation log. So these are updated on a very regular basis. The second thing is to look at the stakeholders. And I'll move to that shortly, but this needs to be a robust group so that everyone is involved. And then the third thing is to update a draft pathway and a survey and send it out to people like yourself in the room today and others to be able to provide feedback. So the stakeholder group includes cardiac rehab staff, program managers, clinical nurse specialists who coordinate all different types of cardiac rehab services. Rural and remote staff, metropolitan staff, community programs, all allied health involved in any of these. We've included the heads of cardiology departments to ensure they would disseminate the information to their teams. Primary care organisations have representation from the RACGP of WA, WA Primary Health Alliance, Rural Health West, Aboriginal community controlled organisations, and ACRA, the Aboriginal Health Council of WA, the Health Consumers Council, non-government organisations, including the peer support leaders who are in WA from Heart Support Australia, and those with lived experience of cardiovascular disease, including those with angina, with heart failure, with stents, with bypasses, etc. Numerous people involved there. And the participants' perspective is so important that we listen to this. And these comments come from the ACRA information, which is the British Heart Foundation have recently renewed their core components and their cardiac rehab ways of doing things. So these are comments from people with lived experience. I think there should be a greater interface between cardiac rehab and GPs. On a number of occasions, I received conflicting advice. I wouldn't have considered mental well-being as part of my rehab if this hadn't been available. With it being on offer, it highlighted how important this side of things is. And another comment around that is, so much has been on the physical side rather than the mental. Since I've come out of hospital, everyone has been concerned about my physical side, maybe 80%, and only 20% mental. The mental side is so important. And I can certainly attest to that, that it is that emotional side of recovery that takes each individual a different amount of time. So the third step is to draft a clear, simple, easy to follow pathway, which was asked in the survey from 2021. So essentially, the cover page is very simple. And page 1 is, what is cardiac rehab? The core components of what will be delivered when you attend a cardiac rehab service. And in the bottom circles is the ways that you might be able to have cardiac rehab secondary prevention delivered. Page 2 is a flow chart of how to refer. So in the middle, this page is essentially you confirm eligibility. So everyone with cardiovascular disease or at high risk is eligible. Have listed some conditions there so that when we have feedback in the survey, we will know, we'll be able to know if we have this right. Then offer choice. Discuss with your patient, offer choice, because that will make it person-centered. When someone's going back to work and needs telehealth, etc. Find your local cardiac rehab. Now, there are directories on Clinician Assist, which is WA Health, and in the Heart Foundation directory. And if you have a service and it's not in both of these, I urge you to get in touch to make sure that your service is listed in both of these places. And then you send your referral. And we've also popped on that page some special considerations for GPs around heart health checks for Aboriginal people and patients who hadn't engaged when they left hospital, and around chronic disease care plans. The next page is from the original document, only just a little less wordy, is the pathway principles, which to my mind is a call to action to ensure cardiac rehab is standard care. tailored services for higher risk groups, flexible person-centered options, respect that and value lived experience, and your patient should be a partner in their care and learn self-management strategies. We need to ensure that cardiac rehab is lifelong, that those changes and that support will provide the best quality of life for these people. We want to encourage communication, referral, and collaboration across sectors and service levels and geographic boundaries. We will provide opportunities for workforce training and upskilling when the pathway is ready to go live. We will determine a minimum data set to record and improve practice in WA and embed continuous evaluation to meet quality standards, especially for Aboriginal and other high-risk populations. And the final page is lived experience resources. So this shows the ways that people with lived experience can access cardiac rehab, and also resources that would be helpful to them in their recovery, and how to find certain practitioners who would be helpful to them. So again, this is from the British Heart Foundation. The cardiac rehab systems and processes have to evolve continuously to ensure they remain relevant and meet patient needs. The research carried out by the British Heart Foundation on patients' experiences and preferences is invaluable to helping ensure cardiac rehab meets patient needs. So the next step is an action step for you all. So it's to engage all the stakeholders, so all those services that are listed, and we have a very large stakeholder group who we will send this survey, which will go out in citizen space in WA Health. And we want your professional oversight, as that will be invaluable to support us in updating the cardiac rehab pathway so it is useful to everyone. You'll be sent a link to the survey early next week, and with possibly the recording of this webinar, so you can look back at that too. The survey will be open for 3 weeks, so you have time to get your voice heard in that survey. And in terms of engagement, I know many of you I can't go traveling around the countryside, but locally, I'm happy to catch up with anyone for a coffee, come to their teams, etc. Oh, is the video Anusha? Is Anusha the only person having audio troubles? Oh, okay. Sorry, Anusha, it might be you. Your end. But for those in country areas, happy to catch up on MS Teams by email, or when you complete the survey, you're welcome to ask to catch up with me. And everything's okay. Okay, good. Okay, sorry, Anusha. Maybe go out and in again. Yeah. There will be opportunities to provide input. So today's webinar, I really want you to have comments, suggestions, questions. I will attend the Rural Health West conference and catch up with people there. I've also attended GP nurse forums too. So, and that's my email and my mobile, if you need to have a chat with me. I just wanted to have a quick aside because recently I did attend a primary care nurses forum, and this was one of the slides from the evaluation, was what GP nurses want to do more of is cardiovascular education and management. And that would be, to my mind, in primary prevention as well as secondary prevention. So that's just an aside. So as you feedback around the survey and the draft pathway, we want you to feedback about how it should look. You know, if that's a folded, a tri-folded brochure, or should the patient page be separate? Please feedback to us how you think it should look. Important to feedback on the content within the pathway. This is the list of cardiac conditions that I've put into boxes. But if appropriately resourced, you know, who could be included? People with familial hypercholesterolemia, which I have. You know, prevention is key. Who can be included, who should not be included, etc. And clinicians and policymakers have a pivotal role to play in advocating for expansion of cardiac rehab. I'd like you to feedback on the core components and the other graphics that are in this. I'm definitely a visual learner, but I think research shows that we're all visual learners. And if we are going to make this accessible for patients and people with lived experience, it needs to have images that are easy to read and work out. So transforming the goals of updating this into action will, for WA, be future-proofing cardiac rehab and secondary prevention, providing everyone gives feedback and we make the right changes to this document. So this is the summary of the who, what, where, when, why, how. So it's the responsibility of all health professionals to promote the benefits of attending and completing cardiac rehab. Updating the cardiac rehab flowchart will provide a mechanism to re-offer when patients decline. The flowchart will be accessible on the WA Health Network site. Educational events will be organised to ensure everyone is ready to use the pathway, which we hope will be ready to go live on the 1st of June. We know that cardiac rehab works. There's mountains of evidence to show that. Adhering to medications, treatment plans, adopting heart-healthy lifestyle is crucial to avoiding a second event. And engagement, education, communication, cooperation with everyone who looks after those with cardiovascular disease through surveys, webinars, presentations, and workshops will get us all, we hope, on the same page. So there's lots of references within that I've referred to, and many of them are really new. And very soon, the core components of cardiac rehab, there is a working group looking at that nationally, and that will come out in alignment with this. So we'll be able to be sure that we have had input from that group too. So thanks for listening. I like this little quote. The pessimist complains about the wind. The optimist hopes it will turn, and the realist adjusts the sails. So let's adjust the sails together. And I know many of us need some time to reflect, but I'm really happy to catch up with anyone on MS Teams or have a coffee and a chat if you're local. So I'll now stop sharing my slides. And Tom, if you could take people's mics off mute, I'll check in case there's been any questions in the chat. Thank you.